The coronavirus continues to spread out of control across the country, and more hospitals are now bracing for a surge of COVID patients. ABC 10 News looks at the plan Scripps Health has to keep its hospitals from getting overwhelmed.
The FDA may soon approve the first COVID vaccine, and 2 San Diegans will be part of the team to review it, what they plan to look for in the data.
ABC 10 News at 6 starts now.
Since the beginning of the pandemic, health experts have warned that if we're not careful, COVID cases could surge out of control and hospitals could be overwhelmed. We have seen that very thing happen across the country, and San Diego may be next. Thank you for joining us. I'm Kimberly Hunt.
And I'm Steve Atkinson. The greatest concern right now is what we will see in the days and weeks after Thanksgiving. Our ABC 10 News reporter Mimi Alcala spoke with a medical officer at Scripps Health about meeting and overcoming those concerns.
We're actually seeing significant increases. We're actually higher than we were back in July.
More people are being hospitalized with COVID-19 across San Diego County, and we're now breaking hospitalization records set during the summer.
Yesterday alone, with the numbers that we got from the county, we had 532 hospitalizations.
Dr. Ghazala Sharif is the chief medical officer for acute care at Scripps Health.
Today at Scripps, we have 117 cases.
She says concern from those in the medical field is growing, not only after local Halloween parties, but as we enter Thanksgiving and the next several holidays. She expects the numbers to continue climbing into early 2021.
What we're seeing now is what we had predicted. We do worry that 2-3 weeks out from now, are we going to see that number increase as well. New Year's Eve is December 31st. If you calculate just exactly what we're seeing now, people start getting sick in that first 2 weeks, and they get really sick and they get hospitalized, and then the intensive care unit comes. So I am very worried.
She says, like many healthcare systems, Scripps is seeing a surge in hospitalizations countywide, but even more in the South Bay, where COVID-19 has hit the community hard. Scripps has a detailed plan in place and has managed to balance hospital capacity by transferring patients to different hospitals in an effort not to overwhelm any specific location.
Every day, between 4 to 5 patients are getting transferred out of the Chula Vista campus. So yesterday, we had 5 transfers. This morning, we had 2 from Chula Vista to Green and 2 Mercy Chula Vista to La Jolla.
Dr. Sharif says hospitals are well equipped with PPE this time around, but while many people may be letting their guards down, she's reminding everyone that this isn't over and will get worse if we don't act now.
Just one thing that you do could impact so many lives afterwards.
Mimi Alcala, ABC 10 News.
Dr. Sharif says she recently met with chief medical officers from hospitals across the county and says they are seeing a similar situation. She says outbreaks within hospital staff is also a growing problem here and across the country, making it more difficult to get traveling nurses to fill in when staff members are sick. Today, the county reported 944 new COVID cases. That brings our overall total to more than 75,000. 4 new deaths were also reported today. There have been 988 local deaths from COVID since the pandemic began.
The County Board of Supervisors approved a $20 million temporary relief package for businesses struggling to make ends meet during the pandemic. The money will benefit restaurants, gyms, movie theaters, and museums, along with those who work in the events industry. It will be distributed as individual grants, meaning the businesses will not have to pay the money back. We have a link to where you can apply on our website, 10news.com.
Right now, the FDA is reviewing Pfizer's application for a COVID-19 vaccine. But before it does get released here in California, a panel of top doctors and scientists appointed by the governor will do a review of their own. 2 of them are from San Diego. And tonight, our ABC 10 News anchor Derek Stahl is going in depth to explain what they'll be looking for.
The governor's 11-member panel has already reviewed Pfizer's early-stage clinical data. Now they're waiting to get their hands on the all-important Phase 3 data, which included thousands of participants. Once they do, they'll have to work very fast. So far, the only people who have seen the fine print on Pfizer's large-scale vaccine trials are the company and members of the FDA. But San Diego doctors Mark Sawyer of Rady Children's Hospital and Rodney Hood of the Multicultural Health Foundation will be among the first members of the public to pour through the details.
I want to look at the data, get an assessment of risk-benefit, and the question I ask is what I take, number one. Number two, if I would take it, would I recommend it to my family?
Here's the timeline. The FDA has scheduled a meeting of its Vaccine Advisory Committee on December 10th. The FDA is expected to issue a decision on whether to grant an emergency use authorization shortly after that. If approved, it'll then be up to the governor's Scientific Safety Review Work Group to issue a recommendation of their own.
The California committee is on notice to be ready for a meeting either later in the day on the 10th or on December 11th. And, it's going to take a few days for the vaccine to really start flowing. I don't think the committee is going to introduce extra delay.
The California committee has promised to issue its decision within 24 hours of the FDA's to avoid slowing down distribution of the vaccine. But that means they may have as few as 3 days to review all the safety and efficacy data. If the FDA grants emergency use authorization, do you envision any scenario where the California Vaccine Safety Panel would reject that authorization?
I think that's very unlikely.
There's always a possibility. I think it's more likely they won't.
Both doctors say they have confidence in the FDA's process, but their task will be to add an extra layer of verification after complaints the Trump administration was putting political pressure on the agency.
I think the governor foresaw that it was going to be very important that the general community accept these vaccines, assuming they're approved and are safe and effective, because otherwise we're not going to get out of this pandemic.
The doctors say they want to make sure that acceptance extends across demographics, so they'll be looking at the numbers closely to see if various racial and ethnic groups had different responses to the vaccine. They'll also be examining the side effects. Early data suggests both Pfizer and Moderna's candidates have harder-hitting short-term side effects than the typical flu vaccine.
Your arm hurts for a day or two. You may feel a little bit under the weather for the first 24 hours. You could even have a mild fever or headache. That's actually a good sign. You want that to happen.
They say those sorts of side effects are evidence the body is building a strong immune response to the vaccine, and it's working well. But they won't know for certain until they review the final numbers. Derek Stahl, ABC 10 News.
And Dr. Sawyer has just been added to the FDA's Vaccine Advisory Committee, so he'll cast a vote on whether to recommend authorization at the national level before the issue moves to California's panel. The People's Alliance for Justice says the CEO of Pfizer just responded to a letter it sent about building trust with communities of color when it comes to a vaccine. In the letter, the CEO shares national data about people of color in its vaccine trials. Today, Reverend Shane Harris said that helps, but it's crucial to get data showing the numbers specific to the San Diego region.
San Diegans and people in our county and in our region deserve to know how many of the 5% of African Americans in our region are participating in the trials. People in this region deserve to know how many Latinx folks are participating in these trials. And it should not be an option for these companies to release this information. It should be mandated by state and federal law.
Reverend Harris says he has also sent letters to Johnson & Johnson and AstraZeneca about their trial information, but has yet to receive a response.
Nearly 4 million Southern Californians are expected to travel this holiday, according to AAA. Hundreds of thousands of them are flying, giving airline workers a challenge. Many flight attendants were furloughed or laid off last month, and those who are still working are now shorthanded. Some say they've had difficulty getting people to wear facial coverings on the planes. Others say their airlines are trying to return operations to normal, even as COVID cases surge out of control. Right now, the biggest hope is that Congress passes a relief bill helping some get their jobs back. Because Thanksgiving will look and feel very different for many people this year, experts say it's important to make sure you and your loved ones are doing well emotionally and mentally. Health experts say because of the pandemic, it's easy to lose sight of the positives. But a big part of celebrating this year is to check in with loved ones, especially if they're on their own.
Those who are elderly or who are living alone because of the increased isolation, they may be much more lonely than we even realize. Reach out to your family, reach out to your friends, and let them know that you care about them, and let yourself hear them say the same to you. So that's one way. Another is, again, maintain those traditions that you're used to.
Experts recommend getting more exercise and starting a gratitude journal to keep track of the things you're thankful for.
Naval Base San Diego is one of many military bases prepared to hold off the COVID outbreak. Many naval bases have raised what's called their health protection level status to Charlie. That's one step below the highest status, and it means that things such as school, daycare, and community activities may be canceled. The Navy says the goal is to keep its personnel at sea safe, along with their families here at home. With concerns that an already surging coronavirus may intensify after Thanksgiving, make sure to keep up with the very latest developments on the ABC 10 News app. You can find it for free in the App Store.
San Diegans facing hunger are often forced to sacrifice food in order to pay rent or health care costs. Feeding San Diego supported them with more than 31 million nutritious meals last year, and now the need is only greater. As part of our Month of a Million Meals campaign, we've already raised more than 564,000 meals, but we are not done. To donate, go to 10news.com, click on Month of a Million Meals.